Nationals refused entry and illegal entrance.
The Ministry of Health has defended its recent controversial directive that Kenyans seeking government services will now have to provide proof of vaccination by December 21st. A section of the population was unhappy with that directive, arguing that vaccine take-up should be voluntary. But the ministry argues that the move will help prevent the possibility of a fifth wave or a spike in infections, and urged Kenyans to get vaccinated without resorting to the enforcement of the Public Health Act. Helen Aura reports.
Vaccination of teenagers aged 15 to 18 with the Pfizer vaccine was set to kick off today across the country. This comes as the Ministry of Health further announced that it has enough vaccines to cater to this age group.
At the moment, we are going to start with our vaccination centers. The teenagers can walk in with their guardian. They give verbal approval and they get vaccinated.
Right.
As we move ahead, we will work with the Ministry of Education and see better strategies to reach them, because we must know that they are the main carriers of the virus.
But Kenyans have taken to social media to express their concern over the directive that the unvaccinated may not be able to access government services after the 21st of December. Amnesty International called out the government on the move, saying it should not coerce Kenyans to get vaccinated. But this is what the government had to say.
First and foremost, his statement did not make COVID-19 vaccination mandatory. Far from that. That statement must be viewed from the fact that it puts in place measures that are for the public health good.
As of today, 6,494,091 million doses have been administered across the country, with 4,033,811 people being partially vaccinated and 2,460,280 now fully vaccinated. The proportion of adults now fully vaccinated stands at 9%. The government further says that it is targeting to vaccinate 27 million Kenyans by 2022. But when asked whether this is in contravention of the Bill of Rights,
I think Amnesty must also realize that even certain rights will have limitations for the public good. If somebody who is highly infectious is going to be in a train going to Mombasa for holiday and infect so many other people, that cannot be said that it has to be waited. In fact, I think Amnesty should be trying to ensure that the inequality on vaccines globally is what should be addressed.
The ministry says that the recent directive has seen an increase in the number of Kenyans getting vaccinated. 88% of health workers have now been fully vaccinated, as well as 79% of teachers. There are still ongoing talks among various multi-agency teams to produce a clear plan for the implementation of the new measures. A 10-day sensitization